Hello, hi everyone. Welcome to my video. I am myself Ravitej Nerti, studying in Atreya Ayurveda Medical College, Bengaluru. Now, in this video, I am going to explain you about an innovative device called Psychic Meter. It is an Ayurvedic based cognitive assessment device which measures the level of intelligence and memory power in children. So, as you can see in the slides, the psychic meter is an innovative device designed to assess the memory power and intellectual capacity of the children. And this device uses a series of questions tailored to a child's age and cognitive abilities, providing a comprehensive evaluation of the child's capacity. The device to assess the level of intelligence and memory power using the Ayurvedic principles. So we are going to fuse the ancient Ayurvedic principles to the modern day technology and gives an enhanced data about the child's ability. So now I am going to explain you about the need for this innovation. So this device bridges between the traditional ancient Ayurvedic principles to the modern day science and early detection of the personalized learning paths and addressing the rise of cognitive and attention disorders and promoting the preventive healthcare and mental wellness. So now I am going to tell you about the aims and objectives of my project. So by analyzing the child's response, the psychic meter generates a detailed report on their cognitive strengths and weaknesses, enabling the parents and educators and healthcare professionals like doctors to examine the psychic disorders in the early stages and develop and target related interventions. This technique has the potential to revolutionize the field of cognitive assessment and provide the valuable insights. So the questions designed in the devices are based on the ancient Ayurvedic principles and modern day technology. So the question categories are based on the Ayurvedic evaluations such as Medas, Smruti, Prakriti analysis, Guna assessment, and mental agni, that is the ability to process the ideas. So now I am going to tell you about what are all the factors the device uses for analyzing the child's capacity. So the Ayurvedic foundations like Trigunas, Doshas, Prakriti analysis, which determines the mind body constitution, and the Ojas. Now I am going to explain you about the primary parameters that the device uses. So for the assessment of Vata dosha, we are going to use the sensor tools like health, heart rate variability sensors, EDA, and for the assessment of Pitta, we are going to use the reaction time and the eye tracking technology. For the assessment of Kapha dosha, we are going to use the structured memory games and EEG. For the assessment of Sattva, Rajas, Tamas doshas, we are going to use the facial emotion detection and brainwave patterns in the ECG. For the assessment of Ojas, we are going to use the HRV, GSR and skin tone and voice stress analysis of the child. Now, I am going to explain you about the software components and hardware components that the device uses. The EEG band, touchscreen tablet, pulse sensor plus GSR, eye tracking camera, and thermal or infrared sensors as the hardware components. And for the software platform, we are going to use the dosha prakriti profiling and the cognitive games and the emotional analysis module and data visualization dashboards. So now I am going to explain you about the workflow, that how the testing method of the device works. So now I am going to, as the child's login into the interface, the initial pulses, GSR check and the baseline dosha activities, all these data are recorded, and the Ayurvedic questions were asked by the device to the child's, and based on the data is framed. The memory games and the emotional analysis during the tasks and the final analysis of stress, focus, memory, and the customized report is generated based on Ayurvedic and scientific metrics. I am going to tell you about the technologies that are used in the device. For the assessment of EEG, I am going to use the Open BCI. For GSR, shimmers. For facial emotions, Open Face. For game day, we are going to Unity. For backend, Python. For Ayurvedic references, customized built from the classical text, we are going to frame the questions. Based on all the data centered by the child, the device is going to give you the recommendations like Ayurvedic medications, dietary changes, yoga and meditations, and the Dinacharya, Rutucharya, and Ratricharya, that the rules, the regimes that should be followed by the child for the healthy growth and development of the child to the parents for their children. Now I am going to tell you about the future enhancement of the device. The future, we are going to for an AI integration for early detection and mobile app interface and the multilingual support and the prototyping and pilot implementation in the upcoming days. And as you can see in the slide, the references that I have took for framing the questions like Charaka Samhita, Susruta Samhita, Ashtanga Hridaya, all these references you can see here. At last, I would like to thank the panel of the Healthcare Summit for giving me an opportunity to present my project and the detailed working model of the device is present and the demo is presented to you in the upcoming days. Thank you.